Today we're here with Dr. Evan discussing why people don't want to get implants done. It seems like there's a fear of not just coming to the dentist, but getting a dental implant. Dr. Evan, can you address that topic of why are people so afraid of dental implants?
Well, I think they're afraid of the dentist in general because they associate the dentist with pain. But if you go to someone who, I always say, if you read the directions on the anesthetic, it's amazing how well that stuff works. And that sounds silly, but it's true. If you do not allow the anesthetic enough time to sink in, it's not going to work. And so, you got to go to someone who's not in a big hurry. I think dentists who have too many patients at one time, they're in too big of a rush to give a nice, first of all, the injection's too fast, so it hurts. They don't leave it in there enough time, so it's kind of a useless thing. You're partially numb, and then you're really numb when you get home.
That was going to be my question, is what are some of the things you do once the patient is in the chair to make it comfortable for them?
Well, the first thing I do every time is test it to see if you're numb. Do a couple poking and prodding. Then I know. And if you take anatomy and you were awake when you took it, you can lay the anesthetic down in a specific order to where the patient is profound is the word, profoundly anesthetized.
Which in lay terms means comfortable?
Comfortable, big fat lip, big fat chin, not just tingly. We're talking, oh my God, what you do to me. That's what I want people going like this, touching that. I like to watch people from the hallway while they're getting numb or marinating, as I say. I can tell when it's starting to take effect because they start to do this. Then I know we're there. But I set a timer. Then I go do something else, and then when the timer goes off, I go back and you ask them, all right, does this? Do you feel fat?
Talk to me a little bit about, once the patient's numb, the mechanics of placing an implant and your experience.
Well, nothing beats experience in general. If you've done a lot of something, you're going to be good. Hopefully you'll be good at it after a while. If you're not, you should do something else. But what was the question again?
The question was, talk to me a little bit about the mechanics.
The mechanics, in other words, how hard it is to place it? Or
yeah.
What do I do?
What do you actually do when you place the implant?
It's really, you're just making a hole. It sounds violent, but you're making a hole in the jaw that's slightly smaller than the implant you're going to place. Okay? Just like if you hang a picture or anything like that. We don't use hammers, okay? But if you're going to place an implant is like a screw, and you put it in there, and it has to be tighter than the hole. And all the instruments are color coordinated, so you don't, if you use a green drill, you use a green implant. Okay, it's pretty, it's like Legos. But the pressure, that's another thing, the pressure that the implant creates, that, in my opinion, tends to reduce pain and bleeding afterwards. So you don't, it's just like when you're, if you apply pressure on something, it'll kind of go a little bit numb. So it's really a lot easier. An extraction versus an extraction and an implant. The extraction implant is less discomfort afterwards than just an extraction.
Because of that compression.
That is correct.
Compression. How do you compare the experience of doing a dental implant for a patient versus a root canal?
Oh, I won't do root canals anymore. I don't believe in it.
Why is that?
Because they have if you talk to a root canal specialist, they'll say, well, everything I do is perfect and I never have anything not work. Well, that's just not true. Everyone has failures. The nice thing about an implant is if you have to redo it, it's very easy to redo. When you have a root canal go bad, then, there's a whole laundry list of things that could be wrong,
And is it true that tooth that you're doing a root canal on is basically dying?
It's already dead.
It's already dead.
Yeah. Once you take the nerve out, it's dead.
So eventually that tooth is going to be
Well,
rejected
again,
by the body?
you talk to, depends who you talk to, but I've done and seen enough root canal disasters to tell you that I would not have a root canal done on me, ever. I pulled my own mother's tooth that could have been root canaled, but I did not because it's just not the best, most predictable treatment.
And then you place an implant in.
The same day. She's in a wheelchair now, but at least she has no dental problems. Not really.
What's the biggest benefit of a dental implant for the patient? If you can come up with, say,
I get to make money.
Okay. And again, let me restate it. For the patient, what would be...
Well, I think that they like that. No, the biggest benefit to them, predictability and long-term. I mean, I like to tell people, if you buy a car, it's basically worthless in 5 to 7 years. Okay, you buy an implant, and you are buying something. People, it's treatment or whatever, but you're buying a product. Don't you want a product that's going to last? That has very low percentage of complications, and if you do, it's fixable. And to me, it's just a wise investment.
Let's say you place an implant on someone that's 30 years old. When are they going to have that implant replaced?
When the new false fashions come out. No, you don't have to ever unless you have a problem with it. And the degree of, once an implant, I use the word happy, once it's happy, that usually takes about a month to find out. It's very rare that you put one in and then put a tooth on, put the crown on, then you have a problem now. And if you're going to have a problem, it's usually within the first month. And even I'll have to tell you that, hey, this isn't working or whatever, but it's like less than, I don't know, whatever percent. It's the most predictable form of treatment. Did I answer the question?
Yes, you did. Very well. And so that implant's basically going to be with the person the rest of their
when
life.
they say you can't take it with you, you can.
Oh.
Implants you can take with you.
There's a sales point for you. You can take it with you.
You can take it with you. That's right. Don't give it to your kids. Get implants.
All right. Well, I'd like to just share with everyone that needs dental treatment, come out and see Dr. Evan. He's great at what he does, and I've had 13 implants placed myself. Doctor, thank you for your time today.
Oh, no, thank you.